So good afternoon, everyone. Thank you very much for attending our second series of the webinar on social epidemiology perspective on COVID-19. So I think all of us, we're aware that the situation is actually still unfolding for Indonesia. So at the moment, I think we still have more than 10,000 cases confirmed, and the case fatality rate is 7.8. So it's still rather high. But on the other hand, we still have very low testing rate, unfortunately. And the Indonesian government have tried to deploy multiple strategies, social distancing, also increasing the rapid testing, and various social security programs has been put forward by the Indonesian government. And we also seen a numbers of growing action from private enterprises, including tobacco industry. So that's probably part of our discussion today. And also various activities provided by the community system. And last week, we specifically discussed about the potential strategy and principle to mitigate social impacts from COVID-19 pandemic, as well as the implementation of a large-scale social distancing in Indonesia, especially for socially and economically disadvantaged community. And following on from last week's discussion, we also recognize that the burden of tobacco consumption is disproportionately affect the poor population in Indonesia. And at least 68% of household in Indonesia has tobacco-related expenditure. And for poor and nearly poor population, what does it mean? It means less money for food, and also less money to spend on education. So these particularly more prominent during the pandemic. So today, we have two excellent speakers to explore these issues further. And the first speaker is Dr. Tara Singh, Ph.D., so the Deputy Regional for Asia Pacific Director for International Union Against Tuberculosis and Lung Diseases. And the second speaker is Dr. Swandewi, the Head of Center for Non-Communicable Diseases, Tobacco Control and Lung Health of Udayana University. And she also a senior lecturer and researcher at the Department of Public Health and Preventative Medicine at Udayana University. So without further ado, I would like to hand it over to Dr. Tara, and directly followed by Dr. Ayu. Please, Dr. Tara.
Thank you very much. Can you hear me?
Yep, we can.
Perfect. Thank you. So this is really a great the learning for all of us, and especially thanks to the Udayana and the whole team for organizing this webinar. So it's my also great honor to learn from all of you regarding the management of the COVID-19. Yeah, and also as we know, this is our shared responsibility to ensure health for all. So today also is an important day. It's a May 1, also known as May Day. We celebrate this International Labour Day to review our past, to understand our present health policies and programs, and to plan for future. So it's a very the important day for all of us, how we can really think together and also make our future strategy to ensure health security for all in coming days. So in this occasion, I would like to also wish good health and safety for all of us. In my the presentation, I would highlight the key the substances of COVID-19, and the moderator already highlighted some of them. So I would also present the association of COVID-19 with tobacco smoking, the association of COVID-19 with NCDs, non-communicable disease, and the key action that needs to be taken by the governments and the civil society as well as the public in large. So I'm presenting a brief report of COVID-19 pandemic in my following slides. Ibu Ayu, I'm not sure whether the slides are there. Or are you sharing my slides? Thank you, Bo. Can you, would you mind to go back to my second slide, third slide? Next, please. Yes, great. In this slide, as we all know, the virus associated with this outbreak originated in China, and it has been designated a severe acute respiratory syndrome that we call coronavirus 2. So, as per the World Health Organization, the disease caused by that virus is known officially now COVID-19. As we all know, on 11 March 2020, WHO declared the COVID-19 outbreak a global pandemic as the novel coronavirus continued to rapidly spread globally. COVID-19 has made us realize the importance of health for all, where no one is left behind. Health security is essential for everyone. The health for all is an old, the slogan, but now the COVID-19 public health emergency reminds us again and again that what else one and else us all. So global community now working together to fight COVID-19 by applying various measures as per the local settings, sharing information and technical guidance, and key universal measures that we have noticed so far is a testing, tracing, and treatments. They are now prime focus. At the same time, non-pharmaceutical measures are equally important, such as safe distancing, banning the mass, the gatherings, and good hygiene, home-based learning, work from the home, and so on. So at the same time, it is also critical, and some of the countries actually they are missing that component to run the essential health services on a regular basis to ensure that the medication to the people living with NCDs, tuberculosis, and HIV, and they all are entitled to get their medication on a everyday or regular basis. And the children are needed to have essential services such as immunizations and the others. So health of the people living in dense area, older people aged 60 plus, people living with the pre-existing conditions such as NCDs should be especially taken care of at this the time of COVID-19 pandemic. So with this background, let me present my the next slide to explain you more about the tobacco pandemic at the global levels and also very briefly in Indonesia as well. Next slide, please. In my this slide, the tobacco pandemic is one of the biggest public health threats, not only in Indonesia but at the global level. Tobacco kills at the moment more than 8 million people each year, and more than 7 million of these deaths are the direct results of tobacco use, while the 1.2 millions are result of the second-hand tobacco smoke. So as we know, around 80% of the over 1 billion smokers worldwide, they live in low and middle income countries. Mostly they are in Asia. In the context of Indonesia, tobacco is alarming. As we know, it is the biggest threat to the health of the people in Indonesia. Indonesia is the prime target of multinational tobacco companies. More concerning is that Indonesia has the world's highest tobacco rates, and more than 2/3 of all men use tobacco every day. So that results, the tobacco kills more than 200,000 people each year in Indonesia. These all deaths can be prevented if we have a strong tobacco control and other public health measures in Indonesia. In addition to that, as you know, Indonesia is the home of about 65 million people who continue to use tobacco each day, and is the only country, Indonesia is the only country in Asia Pacific that hasn't ratified the World Health Organization Framework Convention on Tobacco Control Act. So we can also notice smoking rates have alarmingly increased among youth from 7.2% in 2013 to 9.1% in 2018. The growing burden of tobacco smoking is changing the whole landscape of non-communicable disease care and prevention, as well as our social and the community the programs. So, dear all, I would like to allow me to present the association of COVID-19 and tobacco smoking in my next slide. Next slide, please. Tobacco pandemic fuels COVID-19 pandemic. More worrying is that the association of tobacco smoking with COVID-19. The early studies from China presents smokers are 14 times more likely to be infected by COVID, and they experience worse outcome as compared to non-smoker. And there are several other evidence that presents smokers are susceptible to severe symptoms if they contract COVID-19 compared to non-smokers. And another study also presents that the smokers were 2.4 times more likely to have severe symptoms from COVID-19 compared to those who did not smoke. What does it mean? It means the tobacco use is associated with poor evolution of COVID-19 and also more serious results, including admission to intensive care units, use of mechanical ventilators, and the worst outcome is the death. So let me again briefly present the association of COVID-19 with the e-cigarette and other tobacco products in my next slide. The use of water pipes, the shisha and electronic cigarettes, we call e-cigarettes, and HTP, heated tobacco products, such as the IQOS, have not been proven safe. And we all know they all produce an aerosol that could cause damage to the lungs. So therefore, these products is a risk for transmission of COVID-19 as the user, the exhalation could carry COVID-19. So in summary, the tobacco to use, whether they are e-cigarettes or the conventional products, they pose serious health threat at this moment, and they drive the COVID-19 further. So tobacco use is the major risk factor, as I mentioned earlier, to drive non-communicable disease pandemic. So NCD is also a global pandemic. So in my next slide, I would like to highlight some key figures and facts about NCD at the global level and also in Indonesia. At the global level, the NCDs are rampant, we know, and it's mainly more prevalent in low and middle income countries that affects the poor and also at the same time to rich people. In the context of the countries, so the NCDs are more on with the people that lives in a risky the environments. NCD kills more than 41 million people each year, and that equivalent to 71% of all deaths. The NCD includes, as we all know, cardiovascular disease, the hypertension, the heart attacks, diabetes, cancers, and other chronic respiratory disease. In Indonesia, World Health Organization estimates about 1.4 million people die from non-communicable disease each year. You can see in my slides. So Indonesia, it means Indonesia is witnessing rapid increase in non-communicable disease and deaths. So that is something we need to pay our serious action to prevent this NCD pandemic together with the COVID-19. The next slide presents the evidence showing the association of COVID-19 with NCDs. As far as the information, the evidence that we have so far, COVID-19 may further pose serious threat to the health of the people living with NCDs. The study from Italy presents that respiratory failure was the most commonly observed complications in people with COVID-19, followed by the acute kidney damage. In India, Ministry of Health and Family Welfare, the reports that 86% of death due to COVID-19 have been found in people living with a pre-existing condition such as diabetes, chronic kidney disease, hypertension, and heart problem. So with my next slide, I would like to conclude that the people with NCDs are more likely to suffer severe COVID-19 with serious outcomes, including death. And the scientific evidence suggests that COVID-19 primarily affects to the respiratory systems, causing mild to severe respiratory damage. And tobacco smoking appears to be an important and entirely avoidable risk factor for poorer prognosis in COVID-19. Therefore, the urgent actions are needed now, and now. My next slide presents these action. Next slide, please. It's a time to win the battle with COVID-19. Therefore, we must accelerate our testing, tracing, and treatments, isolation of the cases, and quarantine of contact. Safe distancing and good hygiene, ban of mass gathering, and public awareness is the key. At the same time, as a public health, public the essential health services should be continued. And as we know, the people who live in high-risk populations and people older than 60 years and people living with NCDs, tuberculosis, and pregnant women, they are on high risk, and their health should be taken care of. So we must also win the battle of NCD pandemic. As I mentioned earlier, we must ensure even in this the challenging time for the regular medication and health services of those people living with the NCD. The health system has to find out the ways to reach out to them and to sustain the services so that they can from the medication. And at the same time, as I mentioned, the NCD pandemic, COVID pandemic, and tobacco pandemic. To battle with the tobacco pandemic, we must, at this point, educate our people by running the mass media campaigns and must build the awareness on danger of tobacco and COVID-19. And it is equally important at this moment also to ensure the health system provides the smoking cessation services and help the people who quit smoking. It can be by using the internet, social media, or quit lines. And also, as I mentioned earlier, the exposure to secondhand smoke is also another the big risk factor. So we must ensure that our all public places they are 100% smoke-free, and we should encourage the people at this time to make their the home smoke-free and to avoid smoking inside the home. Governments also must raise the tax and prices so that these products, the tobacco-related products, can be more expensive, and the government can generate more revenue that can be used for the public health and also address the COVID-19 and other any pandemics such as NCDs. So at this moment, during the lockdown, most of us and our children, they are in home. And if the tobacco industry, they are really active to advertise their products through the online. So we would sincerely request the government to ban the tobacco advertising and sponsorship. And at the same time, also the Professor Ayu will also highlight in the next slides, the companies, tobacco companies are very aggressive to position their role, in the community at this time by offering donation and building partnerships. So these must be banned. So in my final slide, I would like to highlight that tobacco is fueling NCDs. NCD is fueling COVID-19 health concern we need urgently to address. Therefore, policymakers, the president, the prime minister, the parliamentarians, the mayors, the ministers, and public health officials, the director general, secretary generals, or any directors, or any the health officials, and program managers, and clinicians, civil societies, media, we must work together to revisit our current public health policies and practice. And we must identify the action that address any pandemic in future. And we must make sure that our health system is up to date. So to conclude my presentation, I would like to also highlight here, we must box COVID-19, tobacco, and NCD in. And COVID-19, tobacco, and NCD in. So we must ensure government's accountability and transparency in the implementation of global and national commitments, global public health treaty, such as Framework Convention on Tobacco Control. If country hasn't signed it, they must sign this and they must implement, such as Indonesia. It's a right time for the government of Indonesia to ratify the WHO FCTC to address the pandemic of tobacco, NCDs, and COVID-19. We must also ensure a strong health system functioning, up to date at all level, at the community level, at the local level, at the regional level, at the national level, and international level. And it is very important, we must build a strong system, health system at the subnational level. We must also ensure the rights to the health for all and also ensure the universal health care. We can see the preliminary data suggests that there is the wider gap between the rich and poor in terms of the health and the health rights. Most important, we must ensure the public participations in all the So it's a time to work together to find out the innovative solutions to prevent the COVID-19 as well as to prevent any future pandemics. I would like to stop here. Thank you very much. Over to you.
Okay, thank you very much, Dr. Tara. So to highlight some of the key points that Dr. Tara bring about on his presentation. So the first one is tobacco actually increase the likelihood of acquiring the COVID-19 as well as increase the likelihood of severe symptoms. And tobacco already killed many Indonesians, and 8 million at least. And also, COVID-19 actually exposed the weak control tobacco in Indonesia. And what quite interesting from this presentation is COVID-19 also exacerbate further the NCD's pandemic, which is I found it's quite powerful. And the key message there is that we need to maintain access to care for non-COVID NCDs, for non-COVID related issues, particularly NCDs, because these going to be heavily affected by the pandemic. And also, COVID-19 actually provide a window in to accelerate the tobacco control policies in Indonesia, but also to improve or to accelerate the access to NCDs, especially for socially and economically disadvantaged population. So the next presentation, Dr. Ayu probably will talk a lot about the growing movement from tobacco industry to provide financial and logistics support during the pandemic. So I think it's actually there is an ethical consideration there. So we're probably going to discuss this further in the discussion later on. But for now, I will hand it over to Dr. Ayu to talk about the issues a little bit more. Go for it.
Good afternoon, everyone. Thank you, Dr. Sutarsa, for the time, and also thank you for providing an opening introduction to the session, which set the scene of the current state of the COVID pandemic and how we are responding to the situation. And also thank you for Pak Tara for your presentation. I would like to follow on from your presentation. I would also like to thank to the participants to join our meeting this afternoon. Among us, there are some prominent tobacco control advocates in Indonesia. I would like to welcome them and thank you for joining the session. Ibu Sumaryati Aryoso from Tobacco Control Support Center in Jakarta, and also Pak Madi from Udayana Central, and also the head of Bali branch for Indonesian Public Health Association. If we have time at the end of the session, maybe we would like to have your comments for the topic. I will start to sharing my presentation. Is it happening? Oh, so Dr. Adi, can you help sharing the purpose? Is it working? Okay. Can you see the presentation? Okay. Thanks to Pak Tara that has described very comprehensively about the connection between tobacco epidemic, COVID-19 pandemic, and also NCD pandemic, which has placed Indonesia in a very challenging situation during this pandemic. He also highlighted that besides the high prevalence of smoking, there's also increasing prevalence of vaping or the use of electronic cigarettes, which also very challenging for our current situation, because around more than 10% of young Indonesians are currently vaping, which will also place them in a very susceptible position to serious COVID-19 infection. Well, Pak Tara has outlined very comprehensively our response to this pandemic. I will try to give an overview about tobacco industry marketing, its misconduct before and during the pandemic. And lastly, I will discuss how we can employ the situation to accelerate tobacco control in Indonesia. Actually, Pak Tara has outlined all tobacco control measures that we should take during the situation. I would like to add on of from what is being said. Before I talk about the tobacco companies, actually Dr. Sutarsa has outlined it in his opening remarks that I would like to talk about social inequalities of smoking. Uh, Last week we discussed about the potential socioeconomic impact of COVID-19 for the community. There will be increasing number of people who probably gonna fall into under the poverty line. And as we know, smoking is unequally distributed across social gradients. More poor people are sorry. Those within the lowest wealth quintile are who the one who's smoking the most. And as WHO highlighted, tobacco and poverty is a vicious cycle because due to opportunity cost spent on money to buy cigarettes and also health expenditure due to tobacco-related diseases. And this condition could be transferred intergeneration because, like the moderator said, personal smoking, parental smoking hamper access to proper nutrition and also access to education, which may lead to the difficulties of the younger generation to pass and escape the poverty trap. Recent published data from National Bureau of Statistics revealed that for 2019, the per capita expenditure for cigarettes is higher than per capita expenditure for rice. This is highlighting how big is the problem of smoking in Indonesia, especially among these disadvantaged populations. In this challenging time, in this pandemic, this community group should given a priority support, not just livelihood support to cope the pandemic, but also more social and structural empowerment, including access to health services, access to medication, like Papara mentioned, access to testing, and also smoking cessation support for those who are smoking. Besides social and structural determinant of health, there is another important determinant which probably we not of us have been aware of. This is the influence of commercial interest on our daily behavior, on our consumption, the food that we consume, and which in turn save our health. Kisbuch et al. In on their commentary in the Lancet define commercial determinant of health as strategies and approaches used by the private sector to promote products that are detrimental to health. As we can see from this figure here, the dynamics to constitute commercial determinant of health, the expanding outreach of corporation, internationalization of trade, which then lead to increased marketing, supply chain, and lobbying, and which potentially have negative impact to health and also the environment. As Sarah already outlined, before the COVID-19 pandemic emerged, the world has been experiencing non-communicable disease pandemic, which propagated by commercial interest of industry that promote unhealthy products such as tobacco industry, alcohol industry, and sugary drink and other industries. As outlined before from previous presentation, NCD are leading to more severe COVID-19 infection, poor outcome, including death. And again, smoking is a major contributor to this problem. I think everyone knows that smoking influenced by complex factors. And when we talk about tobacco use, we can't ignore the factor of smoking, which is the tobacco industry. The tobacco industry acts as the agent who are actively make tobacco products highly available and acceptable for the community and also acceptable among policymakers. And as we can see from this epidemiology triangle, although maybe this triangle has not outlined all probable factors of smoking, But as we can see here, if we would like to reduce smoking, we have to address all factors, not just modifying host factors such as increasing education or increasing awareness around smoking, but we also have to provide supportive environmental uh, conditions through strong policies that control the agents in this tobacco industry to actively promote and their product to make their products highly available and socially acceptable in the community. Well, while the factor of corona is us, the people, which is also probably quite challenging to be controlled because people it's a bit hard. It's not like controlling any factor like mosquitoes. But tobacco industry is also an active and deceitful factor. Tobacco industry historically will always find ways to uh, fight any control measures that will be placed on them. They will try to postpone development of regulation, weaken any regulation, delay implementation, and try to find loopholes within the regulation so they can still market and promote their product. From this figure here, we can see range of tobacco marketing from direct marketing in the middle of the circle to the more indirect method at the outer circle. Unfortunately, until now in Indonesia, all type of tobacco marketing are still operating, only with few limitations imposed by subnational governments such as ban on billboard or point of sale and increase in the pictorial happening from the national government. But uh, other than that, all type of marketing are still available and exposing all Indonesians, including our younger generation. In countries with more advanced tobacco control, tobacco marketing, direct marketing usually have been banned, and it pushed the tobacco companies to move to indirect marketing. But in Indonesia, due to weak tobacco regulation on tobacco advertising, promotion, and sponsorship, the tobacco companies has been strategically combine direct and indirect marketing, combine traditional marketing such as billboard with a more new marketing avenues such as online and social media channels. The impact of this massive and almost unlimited marketing of tobacco has been clearly reflected in the current uh, situation of smoking in Indonesia. The smoking is still highly acceptable. It's not changing in the last 10 or 20 years. It's still acceptable in the community. We have high smoking prevalence, which is the highest in the region. And we also have increasing prevalence among young people, which is very worrying. Among those marketing strategies outlined in the figure, we can see that the so-called corporate social responsibility and sponsorship are form of self-marketing from the tobacco company, which aim to enhance tobacco company image and serve to maintain its legitimacy in the public and in the policy and also corporate sphere. And corporate social responsibility, I think, has been one of the most acceptable indirect marketing in Indonesia. I think everyone has remembered this uh, dispute about tobacco sponsored badminton politics, which is a perfect example of how tobacco company has been success to build their image in the community. The tobacco company distribute their CSR programs, uh, some of them directly and most of them usually through third party or philanthropic organizations, which claim to be independent from the tobacco industry. But as we can see from this picture, they're not just only funded by the tobacco company, but they also use the very same name Charum Foundation, Putra Sampurna Foundation, they have the same name to the tobacco company. And the type of support are broad, from education, art, sport, community empowerment, and even emergency response. During the pandemic, this has been mentioned by the moderator, this image making is continuing. In the time when smoking has been talked more frequently in correlation to the risk of COVID-19 infection, and tobacco company has been trying to preserve their image and to reorient public perception by giving donations, igniting misleading claims, and also promoting their alternative tobacco products. As you can see here from this picture of donation made by uh, the tobacco company's philanthropic organization to the government. It could be argued that in this time of crisis, we should accept any possible support that we can get. However, this is highly complicit while tobacco industry agenda to promote its positive image. Accepting tobacco companies' support will just boost their image as a responsible and respectful company, and it will be hard for us to denormalize smoking when we place the companies and the product as the one who support and probably as hero within this challenging time. I like this quote by WHO that there is a fundamental and irreconcilable conflict between the tobacco industry interest and public health policy interest. It won't meet anywhere in the middle. The only way that tobacco companies, maybe this is extreme, that the only way that tobacco companies to become a responsible company is by stop selling and stop producing products that have been proven deadly. As I mentioned earlier, art communities are one of the target group of tobacco industry sponsorship and CSR. They usually collaborate with famous figures through activities that are appealing to different target groups, including young people. They are also increasingly use online avenues and social media channels. During this pandemic, tobacco companies won't skip the chance. Such as you can see in this picture, the left one is the competition of dancing competition with hashtag menari di rumah aja, dance from home, and the right one is the hashtag menonton di rumah aja or watch from home, featuring famous animation actors, uh, which actively and interactively engage people beautifully in this challenging time. Looking at this strategy, actually in tobacco control, we should uh, embrace these art communities more systematically, including social influencers to support tobacco control campaigns. Other strategies that are repetitively employed by the tobacco company are mismatching and pseudoscience. These tactics have been used to mislead the public and to provide competing evidence to tobacco control research. We can see it starts to happen in this time of pandemic. Well, there is growing evidence suggests that smoking is detrimental to COVID-19 as been outlined by Pak Tara. Uh, there is also contradictory message, for instance, that smoking or nicotine has preventive effects to COVID-19 infection. There are two studies covered by the media recently conducted in France. That the studies are stating that smoker has less risk to catch the COVID-19 infection, which has been covered and put by media with potential misleading patterns such as outlined here. Then Fortunately, the researcher at that university reviewed the studies and clarified the studies are problematic in each design. There is potential bias, selection bias in the study, that the study only involve uh, involve health makers with potentially has lower smoking prevalence. The study excludes severe cases, which will likely also exclude those who smoke. Uh, the researchers fail to acknowledge this weakness of the study, which has to ignite misleading information by the people. But the counter and clarification that has been conducted by this researcher from that university is very important. As we have been experiencing prior and during the COVID-19 pandemic, flow of disinformation, hoax, and other misleading information are very high in Indonesia. So countermeasure to this kind of message is crucial, as well as engagement of media outlets to present a balanced and valid information. Move on to my final topic about accelerating tobacco control in Indonesia. What we should do and what government should do. Pak Farah has been outlining very beautifully in his presentation. I would like to let all of you know that earlier in April, 42 national health and social organizations, including Udayana Central and Indonesian Public Health Association Bali branch, signed a letter to President which urged the government to take stronger tobacco control measures to prevent worse impact of this COVID-19 pandemic. It also includes in maintaining access to proper medication such as outlined by Pak Tara earlier. I would like to uh, outline the recommendation using the WHO Convention on Tobacco Control strategies, and I also add some additional measures at the end. So basically the WHO Framework Convention on Tobacco Control has outlined strategies of tobacco control in terms of several measures that have been proven effective in many countries, which include monitor tobacco use and prevention policies, protect people from tobacco smoke, offer help to quit, warn about the dangers of tobacco, enforce bans on tobacco advertising, promotion, and sponsorship, and raise taxes on tobacco. For monitor, in addition to monitoring tobacco use, in the emergence of COVID-19, I think it is also important to monitor the smoking as a comorbidity of COVID-19 infection. Currently, in the surveillance form and the screening form, there is no question regarding smoking status of the suspect. There are questions around comorbidities of hypertension and diabetes, but there is no question regarding COVID-19, including regarding smoking status. Inclusion of this question, I think, is very important, both in the surveillance and screening form and also in the hospital form, because this will help us to assess the risk of the suspect. Uh, this kind of modification has been conducted by researcher in University of California, San Francisco, which is helping that putting the smoker as a high risk group because uh, when they have a story of smoking, there is a possible increased risk of NCD and also compromised immune among those who smoke. The second measure is to protect from tobacco smoke, as outlined by Pak Tara earlier as well. That smoking is not is not also bad negative impact for the smoker, but also for those who are exposed to tobacco smoke. In this time of pandemic, campaign on smoke-free public place should be enhanced by all the cities and districts. And for those cities who hasn't had any regulation around this, should be uh, pushing the passing of this kind of regulation. And also with the smoking, the increased probability exposure at home because children are learning from home. There's also an urgent need to campaign for smoke-free home. It could be taken, this measure could be taken at small community level, such as kampung free from smoke or a banjar free from smoke. This this initiative could be taken from down at the small level. And the next measure is offer help to quit. I would like to say this is the right time for smokers to stop smoking for several reasons. First one is the reason of COVID-19 disease that probably have severe impact on the respiratory infection. And the second one is the holy Ramadan or fasting month for those who Muslim smoker is actually the right moment for them to quit smoking. And the third one, because of the distancing measure, most of the people probably limiting their travel outside home, which should limit the exposure to environmental cues to smoking, such as billboard or seeing other people smoking. So this could be another increased motivation for the smoker to quit. And last one, because of this pandemic, many people probably lose or reduce their income and even lose their job. So this is a time saving, for the money saving reason. It is also a right reason for smokers to quit. However, we should be fair. This challenging and stressful time. I think we can't expect smokers to smoke without support. Therefore, uh, support support for smoking cessation, such as campaigns, line, and support through social media messaging should be made available for all and including among those who need the most. Yesterday, I attended a webinar by Universitas Gadjah Mada Health Promotion Unit. Prof. Yayi uh, has outlined very comprehensively smoking cessation support and method at different levels, from individual to government level. This strategy should be made available nationally, and I think we always reluctant to the use of nicotine replacement therapy. This provision of nicotine replacement therapy should be also made available for those who really need the most. The next lecture is one about the danger of smoking. As we have probably already know that smoking has been known to increase risk of many diseases, NCDs, and also infectious disease, with increasing risk of tuberculosis, pneumonia, and now the risk of contracting COVID-19. This message should be highlighted. Both government and non-government or other public health organizations should include harm smoking in their current COVID-19 prevention campaign. I think this is important to include it. And it is also important to counter misleading information that has been spread by the tobacco companies. And the next measure is around enforcing ban on PAP and including companies CSR. Patara has outlined that stronger bans with PAP should be continuously proposed at both national and subnational level. And in this uh, pandemic, tobacco company CSR must be rejected. There is a success story from Depok City. This was shared by my colleague from No Tobacco Community, Mr. Bambang Priyono, that the city has been approached twice by Sampurna and Papa to provide the nation. But with the strong leader of mayor, the health office, and the support of North Tobacco community, this the nation has been rejected. So government can reject tobacco companies. And the last empowerment is respect. I think Patara has also described this. Respect is one of the most effective measures in tobacco control. The study shows in Indonesia, cigarettes has not been less affordable. So, in fact, it's become more affordable, which is not good for demand reduction. So, besides the empower measure, I would like to add this additional measure of limiting availability. This probably maybe as additional measure that could be think of at any level of government, because as been there is an example that that has been adopted in prison found in the Philippines, that in the city the selling of cigarettes are prohibited, and in Syria they ban shisha. This measure could be taken temporarily during the pandemic, although long-term provision will always be even better. And besides the accelerating measure during this pandemic, I believe all of us agree that long-term stronger tobacco control is urgently needed in Indonesia. At the moment, there are several regulations under revision or under discussion within the parliament, and there is an urgent need to push this regulation. The revision of current tobacco control regulation, 5109 2012, which I thought to be finished by 2019, but it's still on progress now. I would like to ask those who are in fourth minister to push the revision of the regulation to include ban on theft, larger pictorial health warning, limiting access to cigarettes among young people, and other measures outlined on the empower measures I mentioned earlier. There's also the revision of broadcasting regulation is going on for quite a long time now. I think this is the right moment, as been saying before, that children are exposed to more online television advertising during this time of pandemic. Uh, the parliament should push the adoption of the ban on advertising of smoking in the television, because until now I think it's only Indonesia and a few other countries that still allow cigarette commercial on television. And smoke-free barrel, I mentioned earlier that all cities should push the adoption of strong smoke-free barrel, including strong tax ban, and potentially include smoke-free home. I think that's all the measure that I outlined that could be accelerated during this time and in long term. Uh, this is my final slide. Uh, as Patara touched earlier, the month of May has been considered as tobacco control month. Annually, on the 31st of May, we commemorate World No Tobacco Day. And this year, theme is preventing from tobacco and pollution, preventing from tobacco or nicotine use. The campaign hashtag is somehow aligned with my presentation today is hashtag tobacco exposed. It is about exposing tobacco industry practice, debunk myths, and also empower youth to stay cigarette free. I believe during normal situations, all countries should have been waken up to the call for strengthening tobacco control to improve countries' health status, and especially when a pandemic of respiratory disease hits like today, when all people should be made aware to the importance of a healthy body, of an optimal respiratory system, countries, especially with poor tobacco control projects, must embrace this moment as a window to boost and to scale up its tobacco control measures and to make tobacco industry responsible for its actions. That's all for me. Thank you so much. I should have left 5 NCD as well to this slide. Thank you. Back to you, Dr. Sutarsa.
Thank you very much, Dr. Ayu. So just to highlight some of the key points in Dr. Ayu presentation. So we want to highlight again, there is a clear association between poverty and the tobacco consumption, because tobacco actually disproportionately affect the poor population, especially in the context. So there is also a close relation between tobacco epidemic and then the COVID-19 pandemic, as well as NCD's pandemic. So which is quite critical to acknowledge during the COVID-19 pandemic. So smoking is also a complex phenomenon. So, and there is a role of commercial interests in tobacco consumption in Indonesia, so to increase market for the tobacco consumption. And Dr. Ayu make it really clear that we need to reject the help provided by the GSR from tobacco industry. And that's actually told us that tobacco or TSR, CSR is actually not operating in a vacuum space, but it's actually influenced by political interests of tobacco industry. And there is also a clear message there that there is actually the right time to push forward the tobacco control policies in Indonesia, especially the PP number 19109 2012. So that's some of the key points. So I'll probably just go through some question because we already have some question here. So if you have question, just write it down there. So I will try to read some of your questions. So we have question here for Pak Tara. So this one is from Pak Swarsana. Do you think tobacco consumption actually cause immune problem in the respiratory tracts? And then the second problem is there any evidence out there about protective modalities of tobacco consumption during the pandemic? So that's probably for Pak Tara. Do you have any comment, Pak?
Thank you very much. I think this is a great question. So I would also request Ibu Ayu to add on. But as far as we know, based on the scientific evidence, the COVID-19 actually primarily affects their respiratory systems. It's causing from mild to severe. So the fact that as per the World Health Organization, CDC, the Center for Disease Control and Prevention of United States, they documented clearly that smoking is a risk factor for many lower respiratory tract infection. So we can say there is a perfect the link between COVID-19 and the smoking. Ibu Ayu, would you like to add some?
Dr. Ayu? Okay, we probably come back to Dr. Ayu later on. So there is also a question from Hoirun Nisa there. So is there any evidence out there, Pak, in relation to tobacco actually have a higher risk for acquiring COVID-19? So I remember some of your slide, you actually mentioned there is actually a strong evidence. Do you want to comment on that, Pak?
Thank you. I think there is a strong evidence, that we have, and those the evidences have been already published in international peer-reviewed journal, such as the New England Journal of Medicine and Tobacco Control. Yes, so there are many evidence. So one of the studies from China that show the smokers are 14 times more likely to be infected by COVID-19, and the smoker experience worst outcome is compared to the non-smoker. That's the very strong the evidence already there, and there are many other studies also support the similar the findings. Over to you.
Okay. So hopefully
I would like to
it's
add.
clear. Okay, go for it.
Okay. Yeah. There, like outlined by Patara, there are a couple of evidence. There's even a systematic review that showing the correlation between smoking and the poor outcome of COVID infection. And there are several possible pathophysiology to this one, as mentioned by the several studies, that smoker already has poor lung capacity, which will getting worse with the another respiratory tract infection. And there's also a study that's showing ACE2 receptor, so angiotensin converting enzyme 2 receptor is particularly high among smokers. And this receptor has been used by the virus to piggyback to enter the human cell.
Okay. So there is actually a strong evidence out there. Smokers indeed have in a higher risk for acquiring COVID-19, but also presenting with the severe symptoms associated with COVID-19. So we also have another question here from Serie Ramadan. So why this one probably for Dr. Ayu in relation to a complex environment for smoking adoption. So there is a question here: why smokers keep doing it regardless of the risks of smoking? So why do you think there are many people still consume tobacco products even though they know the risks from tobacco consumption? So do you have any comment on that, Dr. Ayu?
Yeah, thank you. Maybe Patara could add to this as well. Like, yeah, as I provide on the figure on the epidemiology trial, smoking is not just influenced by the host factor. So, improving one's knowledge. Sometimes people have high education, but they still smoke because smoking is influenced by complex factors, the social factors, environmental factors, and in fact, like in Indonesia, as you can see, the promotion of cigarettes are everywhere, digitally available everywhere, and also people smoking are so common and a common norm that people smoke in Indonesia. And it's also a big influence. And as we know, smoking a cigarette is are addictive. That nicotine is addictive. It's also adding to the reason why people are smoking and continue smoking even they know that that smoking is dangerous. And one more thing that I was quite like this because one of my respondents during my study said that Indonesian has quite poor time risk perspective. Smoking, when you smoke, the impact is not immediate. The impact is a long-term impact. So we tend to have less connection with this kind of long-term impact. So that's probably the other reason. Thank you.
So, Patara, you have anything to add?
Just to thank you. I think Ayu has already covered. Just for my, just to add on, especially on the Indonesian context, as Ibu highlighted, the primary, in Asia, I think almost at the global level, we can only see the tobacco advertising, promotion, and sponsorship in Indonesia. So that is the main driver, to sustain the smoking and to encourage the people to smoke. That is that's the main reason. The second is the cigarettes are quite cheap in Indonesia, and they are easily available in any setting, in any area in Indonesia. We can see there are shortage of other medicines and other, but the cigarettes are everywhere. So easy accessibility and availability of the cigarettes also another factors to to encourage the people to smoke.
Okay, thank you for the response. So we have another question here, which is I found it quite interesting. So this is probably mainly to Dr. Ayu. So how can we deal with publication bias, and what's the role of academia in preventing such bias? So there is a question from Anomi. Do you have any comment on that, Dr. Ayu?
Thank you so much. That's a very great question. There are a couple of things that we can check when we have a publication. For instance, for the first thing, we should check about the source of funding. Sometimes those research sponsored by tobacco companies. That's the first thing. And we also should check the conflict of interest. Maybe they have been working for the tobacco companies before. Uh, I think that's the most important thing that we can do to check the possibility of growth and also connection with the tobacco industry on the study. And also we can compare with the rest of evidence. If most of the evidence saying this way and this evidence saying the other way is very controversial, and we should check as well.
Mm, mm. But Tara, do you have any comment on that questions?
Yes, as Ibu highlighted, mostly the industry driven the studies they present some misleading information. The recent studies that published in from the French the doctors actually that shows the nicotine actually would help the against the COVID-19, but that's not true. What we have found that the researchers who did this is really associated with the tobacco industry, and they did this study. When we look at the whole methodology part, it's among the only the healthcare settings and among only the healthcare the personnel. And as we know, the smoking always lower in healthcare, the settings and healthcare professional. So there are many industry tactics. So we have to really look at the funding, the methodology, the type of the settings, and so on. Over to you.
Okay, thank you for the response. So there is another interesting question here about the conflict between a community system and the tobacco industry when they provide some financial support to community system through the foundation created by the tobacco industry. So Ibu Ayu mentioned that we need to reject any GSR from a tobacco industry. So what do you think on this situation? Is there any room to maneuver there, or do you think we need to reject completely, or what do you think?
Personally, I think we should reject completely because, like I mentioned, there always complicit in there's always the commercial interest of the tobacco industry is there. Although I understand maybe some of the community will be really helped by the tobacco company support, but there's another source of support. For instance, like now the community is provided with dana desa by the government. There's another source of support, and I think this is also coming back to the current position of the government with the tobacco industry, because the government hasn't made clear that the tobacco companies should not have been uh, made as a part of CSR group, because there's also the another regulation around corporate regulation, which is allow tobacco companies to be to contribute to CSR program, which is in another country when the country adopts strong steps, then CSR exposure should be done as well.
Okay, so it's clear message there. So we need to reject. We need to using different kind of financial sources to support community system. Okay, Pak Tara, do you have opinion on that?
To add one sentence, as we know, tobacco industry always try to position their image at the community level. by offering donation and partnering also, in a difficult situation like COVID-19. So as Ayu highlighted, there is a need to have the strong regulation to ban all these things, as the CSR is part of the tobacco advertising and promotional as well. And we know the tobacco industry vested interest is to position their product in the community. So, and we know tobacco is a killer, and the industry makes just money by selling the death, So we must reject state rule.
Yeah. Okay. It's also a clear message there. We need to reject all form of CSR from tobacco industry. So there is also a question here in relation to tobacco tax. Yeah, Pak Tara and Dr. Ayu mentioned in their presentation about we need to increase the tax for any tobacco product. And do you have any comment on that in relation to the discriminatory effects of the tobacco tax? And also, is there any comments around how can we promote a smoke-free home?
Can I go first, or Pak Tara?
Go ahead, Ibu.
Okay. Yeah, I think that it's clear that tax is one of the recommended measures for tobacco control, because when there are price increase, there should be reduced demand for cigarettes. And yeah, I know tax is not sometimes not affect equally across different group of people. That's how there should be another strategy that also, for instance, like I said earlier, that another support should be given to those who need help, like the poor family, increase job, increase income generation. So tax could not be the sole strategy. There should be other strategy within those empower message, and also we need to empower the community as well. And the next question around smoke-free home, I think there has been several successful programs. Like I think yesterday, Prof. Yani from UGM said that in Yogyakarta there's around 150 smoke-free kampung. So at the community level, the community can take initiative that educates the people. Those who can quit smoking, that will be better. But for those who can't quit smoking yet, they should smoke outside their house, which will reduce the exposure of tobacco to their families, including children. Because as we know, around 80% of the children are exposed to tobacco smoke at home. That's something I think that's all.
Yeah, Pak Tara, do you have any comment on that?
Thank you. Just to add on, Ibu Ayu, creating a smoke-free home is one of the opportunity now. I can see how we can do that. I think this is the perfect time when in the Indonesia setting, especially the all school now is the education is home-based learning. So the education ministry, the academia, the teachers, they can at least put some message while they teach their students to help their parents to quit smoking, and also to educate the people who smoke inside the home not to smoke actually. So the youth can play a bigger role to help in creating smoke-free at this stage. And the second one is the health system. The primary healthcare system should be really active now, and they should take a step up to mobilize the wider information of the creating smoke-free and the tobacco cessation and all, by mobilizing the visitors, not maybe at this moment, but after post-COVID, and every visitor should be counseled or offered the education to create the home smoke-free and encourage them to quit. The last point regarding the tax, as I mentioned, the tax, raising tax and prices on tobacco product is one of the most effective the intervention to reduce consumption and also to encourage the people to quit smoking. At the same time, as Ivo, you mentioned, it has to go with the larger package of the tobacco control, that the smoke-free, ban the advertising, larger the graphic health warnings on the tobacco pack. That's the most powerful the tool to educate our people and the community. And at the same time, we need to offer the cessation support. Over to you.
Okay, so thank you for the comprehensive response. So we have another questions here. So particularly for Dr. Ayu, so regarding the law enforcement for free smoke area.
Yeah, regarding the smoke-free bylaw, some cities have been adopting this regulation. Maybe Papa could add on this topic as well. For instance, like here in Bali, the Bali provincial government is the first one who adopts provincial level smoke-free bylaw, and followed by smoke-free bylaw in all districts and cities. The enforcement is still going on, and during the enforcement, usually there are coordinated groups that consist of government and non-government organizations from health office and from different sectors, and also civil police. They usually conduct for the enforcement. There are also responsibility of the stakeholder related to the place, like the manager and the owner of the public places, is also made responsible to enforce smoke-free by law. I think during this time when people is actually not really going out, could be even better, that the enforcement could be made stronger, and with the increasing use of vaping, smoke-free by law should maybe those who haven't include vaping should be amended, and include use of electronic cigarette and ban of use of electronic cigarette and vaping in public places as well. Yeah, thank you. Is there any other question? I mean, is that all the question? You still mute, Dr. Sutarsa. Still mute. You are still mute.
So yeah, that's the last question that we have. Pak Tara, do you have any comment on the law enforcement of free smoke areas?
Yes, in Indonesia, if you look at the the subnational, especially subnational level at the city, province, and the district levels, there are many more than 300 bylaws are in place. They are quite comprehensive. So to really bring the intended the outcomes, that means the preventing the second-hand exposure, we need a strong law enforcement. So at the moment in Indonesia, the law enforcement is quite weak. So one of the primary reasons of this is the industry interference. The industries are everywhere, from community up to national level. So they are really undermining the enforcements, and they are also they're doing some lobbying with the local government and the national governments as well. So here the governments needs to really step up and should have a strong mechanism for the effective implementation and enforcement by mobilizing their different governments, departments at the city level, at the district levels. At the same time, government must educate the public to comply the regulation. So we need both publics and the governments, the engagement to have the better implementation and enforcement. I think that is really needed in Indonesia. Otherwise, we would face there's some severe, the serious pandemic of NCD in Indonesia. Over to you.
Yeah, it's a really good elaboration. So we have the very last question here. So it's from Ahmad Rizal. So how to suppress and give stern appeal to the community, especially those who are in the field of academics. So do you have any comment on that, either Dr. Ayu or Pak Tara?
If I get the question correctly, so what it is around collaborating with tobacco companies, or what is the?
Yeah, so it's essentially yeah. So how to prevent maybe collusion or between academics and tobacco industry. I think that's where the question is actually heading towards.
Okay. Yeah, as I mentioned, the tobacco companies will usually try to contact and try to collaborate with the researchers and as has been experienced by some of my colleagues and really approached by the foundation. So we should do some fact check about those who approach us, like from where and who are they, or they have a connection with the tobacco company. We should do some fact check around them, and also uh, I'm not sure with the research grant, for instance, for research around with collaboration directly from tobacco industry. But sadly, I think last year the Ministry of uh, Higher Research and Technology is accepting collaboration from the tobacco company. So but from the academic perspective, we should try to do fact check and do not collaborate with tobacco industry. We should be avoiding that. But sadly, in the higher level, at the ministry level, they still did this collaboration. Thank you.
Okay, so yeah, so we have one more question. Dr. Adi, do we still have time?
Let's go ahead.
Yeah, we have a really good question here and very practical. So, what can city mayor do for tobacco control during the COVID-19 pandemic? So, any response from either Dr. Ayu or Pak Tara? So, I think it's quite important question and very practical.
I think all the measure and recommendation that are outlined by me or by Pak Tara could be done by the city mayor. So in terms of monitoring and also campaigning and educating people, all the measure could be done at subnational level. We do need to wait from national level. So because we have been observed in Indonesia, some subnational governments actually move uh, forward beyond the national regulation or provision. So there are chance and possibility for subnational government to take action for all those measures, like educate people over how to treat and improving the smoke-free dialogue, including smoke-free home, and except rising tax, because rising tax is a national government, so the other measures subnational government is likely can do.
Pak Tara, do you have any comment on that?
Just quick, in the context of the Indonesia, the city mayors are in the best position to offer the solution locally. The solution in tobacco control, at the moment, they can really engage the local, the civil society organizations and the youth-based organization and the religious organization as well. Why I'm saying is the COVID-19 is a one, let's say, it's an opportunity, and at the same time, in Indonesia, it's a Ramadan is another opportunity to really enhance the tobacco control program at the subnational level. So city mayor can really work together with all the religious leaders as well. At the same time, it's a time to really engage the health system to offer the smoking cessation. And also by the internet or social media as well. And city mayor also can run the mass media campaign at the local level through the televisions or the radio to support smoker to quit. In addition to that, I would also say the city mayors can also they ban the local tobacco advertising, promotion, and sponsorship, and completely reject the industry's donations and partnership. Over to you.
Okay, the last two questions. So we have question here. So the consumption of vaping, so it's a lot higher among young people, and any explanation why? And also, how can we encourage or empower young people to promote tobacco control measures in their society? So who want to respond first? Dr. Ayu, do you want to answer to that questions?
About the use of typing, I think I mean, not only in Indonesia, typing is increasingly popular among young people because the way the typing is promoted, they mostly use social media. They also portray as a similar cigarette, like a cool, and also some designs really appealing to young people. Some of the electronic cigarettes is shaped as a USB stick, which is very appealing to young generation. Yeah. About the the danger, although they know the danger, this is quite similar to smoking because of the high promotion and marketing. There's also make uh, the awareness around vaping sometimes that's suppressed by this promotion. And and the second question is to build the capacity for the
Capacity of young people
yeah.
to do a campaign during the COVID-19 pandemic.
Probably I can give an example from our own student group in Udayana University. We have a student group that, uh, uh, I mean, the group is mainly promoting on tobacco control and how to be safe. And the building up, I think that there's a set of steps that we can use, can do to empower them. The first thing we should provide capacity building for what information and what skill they should know, like around tobacco control, around tobacco industry marketing, and and then actively involve them to build the campaign because sometimes building campaigns for young generation should be come from them because they have different views, different choices, and different perspectives. And because they stay at home and study from home, still can do like we are now collaborating for or about the World No Tobacco Day in Bali through online channel. We hope WhatsApp group discussion and the student can use Instagram to provide campaign to provide messages to online and social media channel. Thank you.
Pak Tara, any comment?
Yes, Ibu highlighted already. So I want to add on. The government must have the strong the regulation both at national and subnational level to ban the e-cigarette. I think that is needed. Otherwise, we would face a double pandemic of the conventional cigarette and also the e-cigarette as well in the context of Indonesia. So regulations and rules are really, really important to save our generation. The second point, the teachers, the professors are the change agent in our society. So I think in an Indonesian context, now is a time to really, the step up on tobacco control issue from the academicians and also the civil societies as well to really make the governments accountable in tobacco control issues. Over to you.
Thank you. Thank you for both of the speakers. So if we open the question and answer, so we're probably going to have a lot more question and then we're running out of time. So I'm probably going to highlight some of the key points there. So there is an intersection between tobacco epidemic and then COVID-19 pandemic as well as and cities pandemic. And there is actually a window of opportunity there to accelerate both tobacco control measures as well as access to NCD care. And we need a range of tobacco control measures to be put in place. So there is no single intervention that might work for Indonesia, but we need a range of intervention strategies. I would like to invite Pak Tara to give concluding remark. Do you have any final comment?
Thank you. I would like to, thanks all of you, and it's a time to again really revitalize our the primary healthcare and even the health system. So we and the COVID-19 has given as opportunity actually to our generation to strengthen our health system and create the good environment for our future generation. Over to you, Pak.
Thank you. Dr. Ayu, do you have any concluding comments?
Okay. Thank you so much, everyone, for such interesting session. Yeah, like I mentioned earlier, this is the time for all of us to set up our public health campaigns and programs to tackle all the issues, including tobacco control, NCD, and COVID pandemic. And also, we should strengthen community and health system to support to fight this pandemic and to prevent a further pandemic in the future.
Okay, thank you very much, Dr. Ayu. And I would like to thank all the participants for active listening as well as for the questions, really critical and interesting questions. And for the video and the material for this webinar will be available on YouTube. So you can go to the YouTube channel Kesmas TV and you will find the link there, including the certificate for the seminar. Okay, I would like to give it back to Dr. Adi Wirawan to give some hint about our next webinar. Thank you.
Thank you, Sutarsa, for moderating the session. Bapak Ibu, terima kasih sudah bergabung. Sesi berikutnya kita akan membahas tentang topik yang sangat dinanti-nantikan mungkin ya. Topiknya nanti adalah kapan pandemi COVID akan berakhir. Jadi kita akan menghadirkan Pak Pandu Riono dari UI dan juga field epidemiolog dari Universitas UTN. Sampai ketemu di sesi seri ketiga dari webinarnya. Sampai ketemu. Terima kasih partisipasinya. Terima kasih Pak Tara. Terima kasih Hidi Denpasar. Terima kasih IAKMI Bali. Terima kasih Dr. Ayu. Sarse semuanya. Terima kasih.
Terima kasih.
Thank you. Terima kasih.
Thank you very much.
Thank you, Pak Tara.
Thank you, Ibu. Thank you all. That's great. Yeah.
Thank you, Pak Tara.
Thank you, Pak. Thank you very much for your excellent moderation.
Thanks, Sutarsa. See you.
See you next week. Thank you.